believe in yourself. You are in this field for a reason, and you made it all past nursing school for a reason. And you are here with your license, and you are ready. And the number one thing is contradictory to anything that you might know even previous to nursing, is be okay with mistakes, because they're going to happen. And they can be either as small as, hey, maybe you're an hour or 2 hours late on a medication. Or it can be really big as, oh my goodness, there could be harm to the patient. And just being okay and being comfortable with making those mistakes and knowing that you're doing your best is probably the best that you can do. Because once you're okay with making those mistakes, you're able to let the people that are supposed to know. You're also able to be accountable for the mistakes that you make, and being able to overall just make sure that the patient is put at the most highest priority, because you're okay with knowing that you are not perfect. And I had an absolute terrible time with this in the beginning. At the very beginning, I was, left and right making these little mistakes, forgetting these things every now and then. My preceptor is saying, hey, you need to be faster. You need to be able to do this better. You need to be able to think critically in this situation. Making those mistakes were really, really, really hard on me. And being in nursing school and being type of like a perfectionist, straight A's, type of, oh my gosh, I want to be all my projects, all my things to be perfect, look absolutely stellar. And being on the floor and being, I am not perfect, and having that kind of realization wash over me was a struggle. So being okay to make those mistakes and to own up to them is one of the best things to do as a new nurse.
One thing that I would recommend to new grads is kind of learning how to deal with that stress while you're at work, because it can be pretty overwhelming in those first couple weeks. My biggest piece of advice is to just really get a good relationship with your preceptor. So that's your outlet to express that stress, frustration, if you're having a hard time that day. Just talking about it simply is just the best way to get that stress off and to kind of be heard for what you feel like is going on. I like to go home and talk to my nurse friends outside of work, because I try not to dwell on it during the day. But always exercising, being mindful, even just taking a walk on your days off, it can just be huge for kind of your mental health with a job that really requires a lot of strength mentally.
So nursing can be a stressful and hard job, but it also can be so rewarding. Sometimes you're having a really busy day and you aren't feeling very positive and you're behind and you haven't had a chance to finish your coffee yet, or, use the bathroom or whatever. So you're feeling stressed, but that's not your patient's fault. So what I try to remind myself is, try to make someone else's day better today. And they don't feel good and they're in the hospital. And, you're like their advocate, you're their person, and just really be there for them. And it's not their fault you're having a bad day. So, just be there for your patient and ask them, like, what can I do for you today? Like, how can I make your day better? And I think that just really helps to connect to the patient, and it helps you to, like, find fulfillment in your job as well.
New nurses to develop skills, I think it is ability to find resources. Understand that you should have everything in front of you to succeed. And there might not be somebody who comes up to you and offers that all-in-one package. It's unlikely. Oftentimes, you have to seek out your own journey and excel in other areas by learning different specialties, by taking an extra class, by asking people who work in those departments, or asking more and more and more questions to fulfill your needs to get better. And that's ultimately up to you. Where do you want to be better?
So you as a new grad, again, it's going to be challenging no matter where you are, what unit, what specialty. Give yourself patience and give yourself grace to learn the job, because there is no amount of experience that you can get in nursing school that is going to prepare you for the actual job. And your job is very important. Your job matters, and your job is so cool. So take advantage, but also take the time to learn it. Study your patients, the medications on your days off. I promise it will pay off and it will make the job a lot easier. But again, in that process, it's going to be difficult. Take it day by day and know that one day you will feel confident taking care of your patients and they will feel safe and confident in you and be grateful for all the time that you took to properly take care of them.
Your learning doesn't end when you clock out. As a new nurse to practice, I will say that. When you go home, do your research. Instead of just going home, if you have, an hour or so where you would be binge watching Netflix, switch it up. Find some educational things on YouTube. If you had to insert a Foley that day and you struggled with something, YouTube it. Again, everything is at your fingertips. I even heard that there's this cool company called Simple Nursing who has many different resources to help you navigate through understanding disease processes, your lab values, and how to perform different skills. You want to research that when you're new to practice. Every moment you have, it's going to kind of be like you're studying in school again. Not as strenuous, but it's definitely, you need to understand how to do your job, because at the end of whatever that time frame is that you're going to be on orientation with your preceptor, you're on your own. And while you might have your coworkers around to help you with certain things, they will not be able to carry you. And that is very important to understand and remember. So again, continue your learning at home while you're on orientation.
I want the nurses to know that you are here for a reason and you are smart, you are intelligent. What you have to say matters, and just be confident in yourself and know that you're here for the right reasons. Why you chose this career is for a reason. So you're in the right place.
Thanks for watching. To get full access to our Simple Nursing New Grad Prep course filled with tons of helpful tips and tricks, simply click the link in our description below. Remember, don't be scared, be prepared. Ensure a smooth transition into your nursing career with our new course. See you guys there.